There are several variations of birth control that can lead to irregular vaginal bleeding. They include 1. Combined hormonal contraceptives. Combined hormonal contraceptives contain both estrogen and progesterone, which are female sex hormones. They come in the forms of pills, patches, and vaginal rings. The most common side effect of this type of birth control is irregular vaginal bleeding. As many as 50% of people using this form of birth control will experience it within the first 6 months of use. 2. Hormonal intrauterine devices, IUD. An IUD is a T-shaped device inserted into the uterus as a way to prevent an unwanted pregnancy. The device can stay in the body for up to 7 years in some cases. Hormonal IUDs contain a progestin hormone known as levonorgestrel, which acts similarly to progesterone. People who choose this birth control route can expect irregular vaginal bleeding for the first 6 months. However, the bleeding from IUDs should decrease slowly after that first 6-month period. 3. Copper IUDs. A copper IUD contains copper as opposed to hormones. It is placed in the uterus in the same way as a hormonal IUD. For people with the copper IUD, irregular vaginal bleeding is incredibly common. Up to 70% of people who use this method will have to deal with the side effect for up to 6 months after getting it inserted. 4. Implants. Placed in the upper arm below the skin, the implant contraceptive works by releasing the hormone progestin at specific times. Once it is in place in the upper arm, it can stay there for up to 3 years. The most common side effect of a contraceptive implant is irregular bleeding. As many as 78% of people who use the implant will experience it. 5. Injectable contraceptives. Injectables, or shots, are administered through a quarterly injection. They contain the hormone progestin. One of the most common side effects of the shot is a complete loss of a menstrual period, or amenorrhea. In the first 3 months, users often experience irregular vaginal bleeding.